So as you know, Hasan, the Jackson Society and the White Coat Fund were really founded to create a connection between our current and our former residents who trained here in the MGH Department of Medicine. In addition to providing a forum to connect them, the Jackson Society has also advanced research from our promising residents, ideas that have really spurned from them while they've been on the Bigelow. So tell me a little bit of what were the thoughts in terms of putting together the Jackson Society shortly after our 200th anniversary?
It was the realization that career trajectory is a lot more complicated than in my time. My time, there was academic medicine and there was private practice, and the academic medicine usually involved research. So it was pretty simple. You either picked one or the other. Nowadays, there is ambulatory primary care, there's hospitalist medicine, there's subspecialty training, there's research, there is health policy, and so on and so forth. So it really becomes complicated when residents are trying to choose their trajectory. They feel like they're giving up a lot of their fundamental skills when they choose a non-traditional. So we wanted to use the people out in the world to connect them to their to trainees, so that it becomes a little more facile in terms of their choices.
Yeah, you and I have both seen the great connections occurring between our alumni and some of our current residents around jobs, career trajectory. So it's been a wonderful, wonderful opportunity to really make those connections. So since the creation of the Jackson Society, we've actually had 16 resident-led projects that have been funded by the White Coat Fund, which is a fund that's completely supported by donations from the alumni and our current faculty. And those projects, as you know, have spanned from anywhere from improving our MGH outpatient clinic experiences for our residents to actually having a resident focus on continuity clinics in rural Nepal. So as a frequent donor yourself and a program director for 20 years and a member of our Jackson Society board, why do you believe that supporting these budding research ideas emanating from our current residents is so integral to the future success of our trainees?
I think people come here for a specific reason. They can get good clinical training anywhere, a lot of places. This thing that sets the MGH and places like it apart, or the unique features of what they can accomplish. It is, as you say, pursue their curiosity beyond their clinical training. And in that sense, the funding for the Jackson Society is fundamental to creating an environment in which you can not only say you can pursue things outside of the core curriculum, but facilitate that by giving grants and promoting not what they think, but the fact that it's their thoughts that count.
It really is, and the residents actually generate a lot of these questions when they're on the Bigelow, and they're seeing things that they don't have the answers to. They look to the literature, don't find the answers, and then generate a research proposal when they find a mentor, and then we have the tough job of trying to figure out who out of all of those meritorious applications we want to fund. It's been a wonderful program. What are your thoughts on that?
My thoughts are it's it's as you said, it's been exemplary in terms of what they ask us questions and how they answer the questions. I think even in a project with modest input, you can accomplish a lot, and it's science as it should be.
And one of the things I think about when I think about the Jackson Society and the White Coat Fund is that it really does help us maintain our culture of intellectual curiosity and teamwork. Many of the things that I think our alumni would actually resonate with, what their own days were when they were walking the halls of the White Building or the Bigelow Building, and really this does give us the opportunity to kind of continue to make sure that we're promoting that type of intellectual curiosity.
I think when you say that, I think of things like Lee Goldman and the project around preoperative evaluation, the vitamin D story. Who was it? DLJ, Don Lloyd Jones, and his group. That is the MGH, and I hope it continues to be the MGH.